So I'm going to briefly go through the involvement of the different agencies just to outline, and some of these are pretty obvious, the things that didn't happen and should have happened in terms of following procedures and so on. As in so many serious case reviews, we don't need procedures, we just need people to know and follow the ones we've got already. In all, the police dealt with 27 episodes of domestic abuse. These are the ones they knew about and were called to. It involved all mother's 3 partners. When she was in the UK, there was one, the first of her partners in the UK was Daniel's father, who returned home shortly after. She had another violent relationship in the meantime. That partner was actually jailed for assaulting her, but no doubt she'd assaulted him as well. She was as likely to be found wielding a knife when the police called, as were any of the males in her household. They didn't always do safe and well checks on the children. They accepted too readily parental accounts that the children didn't witness or know about what was going on. There was a very heavy backlog of work in Coventry at the time in terms of even getting the notification to the health visitors. Sometimes these were sent in batches months after the events referred to. MARACs weren't arranged and risk assessments weren't done. Where there were strategy meetings, these were often delayed. Where these recommended investigation sometimes took place, but it didn't lead to any case conferences, where other agencies such as school could have contributed what they knew. This is some of the information, of course, which many of you will have read about. The police managed to uncover, as they say, from translating text messages. They found out that, and going back to look at the house properly after the other children had been removed after the night of death, they found out that actually it was strange that there was no bedroom for Daniel in the house. His older sister had a room which was all pink and girly. There was only one bed in it. Where did Daniel sleep? Well, he slept in a cell. He slept in the box room from which the door handle had been removed so that he couldn't get out and his sister couldn't open the door to let him out or feed him, which she tried to do previously. He was subjected to salt poisoning on a number of occasions. We don't know if this contributed to his fatal illness, but from the extent of the diabetes insipidus, it probably wouldn't have made any difference. He was repeatedly near drowned in the bath by his mother to the point of unconsciousness. His sister tried to save him on some of these occasions. He was beaten frequently. He was starved. The school were told not to feed him. He had a medical disorder and they weren't to give him food. He was made to do sit-ups and squats and run on the spot and stand in the corner for extended periods. And this is the room he was found, and the mattress the police eventually uncovered hidden downstairs. Throughout all this period, in fact, social care managed 4 assessments of Daniel, from 2008 through to 2001. In 2008, there was an initial assessment which we thought that parents had adopted strategies to deal with the domestic violence. It wasn't explained how this conclusion was reached, but the case was dropped. The next time, there was no further action because they considered that mother was able to protect the children from what was going on. The next time, mother's 3rd partner had left the home, so it was thought there was no continuing risk. And the final assessment, sorry, this is missed it actually, 2011. Alcohol misuse was thought to be no longer an issue, so the domestic violence would cease now. So all the usual faults that we find in serious case reviews: start again, approach to each assessment, not looking at the history as a whole, insufficient depth, irrational beliefs that domestic violence and alcohol abuse somehow stop magically, failure to look at the male in the household, particularly when it was the new male, as in the case of Mariusz, who finally killed him. In fact, the male partner was engaged or involved in only one of the 4 assessments. There wasn't enough consideration of the domestic abuse as a cause of emotional harm, and at no stage were the children looked at from the point of view of valuing their own experience with the important things that were being talked about in the session on neglect this morning. What were the children's views? What was it like to be a child in this household? School had concerns from the beginning. Latterly, attendance was extremely poor, which should have been a warning flag in itself. They were aware of abnormal eating behaviour from the time he started school, not only in the weeks prior to his death. They saw bruising of the head and neck, didn't document this adequately, didn't refer any of these, although if you look at the Core Info website, obviously this is bruising which should be considered for abuse. The deputy head was concerned not only that he was losing weight laterally, but he wasn't growing, he'd stopped growing. From the time of school, his peers had grown and he hadn't. He was thought initially to be quite bright when he started school, but unlike his sister, he didn't learn to speak English. She was speaking English perfectly within 6 months of starting school. He didn't learn anything, and in fact, obviously he only had one of 17 languages in the school. There were no regular adult Polish speakers in the school. Sister had to interpret for him most of the time, and they only brought in an interpreter to speak to Daniel directly just before he died, and she wasn't able to get him to engage. The Health Visiting Service, amongst many agencies, didn't assess Daniel properly. They had the knowledge through police notifications of the level of domestic violence and alcohol abuse. They assessed all the children, the younger two in particular, as only needing a basic level of service, not an enhanced service which would have been appropriate. And they didn't pursue things sufficiently when parents failed to engage. When social care dropped a case, they tried to pursue the social worker rather than visiting the home and assessing Daniel's health and progress for themselves. The last pregnancy was a particular opportunity for intervention, but when the midwife phoned up Children's Social Care, she says, "Oh, we know about this family." She was told, "You don't need to make a referral, there's already an assessment being done." But in fact, of course, she was phoning about new concerns, and she should have persisted with the referral. There was very aggressive behaviour by the partner during this pregnancy, including ripping a drip out of mother's arm when she was being given IV antibiotics for a kidney infection, insisting on a move to another hospital and then moving back again. And the midwifery staff were very aware of the threats and the domestic violence. But as I say, they weren't able to get their concerns through to social care. The fractured arm, from the health point of view, again, this is the one learning lesson we have. Far too often, social workers want paediatricians and other health staff to say, this injury was accidental, that one was non-accidental, and we'll proceed on that basis. And of course, you can't do that most of the time. All we can give them is probabilities, and that's not what they want to know. In this case, they asked, is it possible the fracture could have been accidental? And the paediatrician discussed it with the orthopaedic surgeon and said, well, yes, it might be. But of course, an oblique fracture of the upper arm bone needs a twisting force. It doesn't happen in normal falls in childhood. It's the commonest form of abusive arm fracture in infancy, and it should have been considered as abusive in this case. But the police didn't follow it up, and Children's Social Care didn't follow it up. Sister said she and Daniel had been jumping off the sofa, which was quite possibly the case, but it didn't account for the accident. Almost certainly, we learned afterwards, it's because Daniel was down the back of the sofa, partner yanked him out over the sofa by his arm, twisting as he went. But the paediatric staff didn't manage to get that balance of probability across to police and social care at the strategy meeting. There were other warning features in this presentation. Does anybody use the Bath and Bristol screening tool for A&E presentation? It is quite widely used in the country in terms of 4 questions. Has there been a delay for which there's no good explanation? In this case, yes. Is the history consistent? in this case, no, actually. If you look at it, partner said he was upstairs when it happened, when he spoke to A&E staff, when he spoke to the orthopaedic surgeon, said yes, he was in the room, he saw it happen. Not consistent history that there was no pain. The parent said he wasn't in pain when it happened, he slept. It was only in the morning when they noticed the swelling that they took him to the emergency department. There were lots of warning signs in this presentation which weren't paid heed to. Are there any unexplained injuries? There may have been a slight doubt about the fracture, but there was a lot of bruises as well, which weren't really considered at all, because the focus was just on the fracture. Then, finally, in terms of medical evidence, we come to what I think is the most critical in terms of long-term harm, which is what were the presenting features that Daniel had in the hole, and what is the cause of these? How are these important, or would have these been important to his future if he hadn't been killed? We couldn't predict that he was going to be killed, but we should have recognised that he was being seriously harmed by these parents. His health and development were seriously impaired. He had this excessive appetite and stealing and scavenging, which is very unusual eating behaviour, particularly in this day and age. He delayed speech and language, classical of deprivation, slow learning or inability to learn virtually. He really wasn't making any progress at school at all. He had slow growth in height, and terminally he was actually losing weight as well. Poor school attendance, social isolation, repetitive behaviours. Little light comes on. Oh, he's autistic. I'll come back to that. Excessive drinking, poor sleeping, unexplained bruising. So all these features could be caused by abuse. Some of them could be caused by other things, but abuse is the only unifying diagnosis for his presentation.